Hi, Tom.
Hi, Rach.
So this short video is to share with those interested about this online chat and discussion that Tom and I are going to be having over the coming months, because we do this between ourselves all the time, don't we? And we thought it might be interesting to actually do it online and share it on demand so that our audiences can feedback and pose us further questions. So the idea being we discuss and chat around controversial subjects, interesting common ideas and principles within our sector, and really anything that relates to being a practitioner that works with human bodies. Looking at maybe the evidence, having a discussion around dissecting questions is, I think, what we were really keen to do, wasn't it? And then really share maybe our different views on it, or maybe our common views on it. Isn't that
Mhm.
right, Tom?
Yeah, 100%. I think I know you're the same. I think a lot of my learning has come from conversations between classes, or if I've taught a weekend and you've taught a weekend and we've had emails, or we talk on the phone. And I think there's obviously the learning of anatomy and exercise and techniques and also methods, but then there's also just the critical thinking or the throwing out of ideas between trusted professionals and friends. And I think that's really important. And I've been very lucky in my career that I've had people like you or Martin or Mike where I can actually just throw ideas at them and it's an open conversation. And I think a lot of people don't necessarily have that. Maybe they don't have the environment where they feel they can do that, or they just don't have the network. So I think us having a bit of an open conversation about topics that would probably change our mind on as well over the next couple of years, it can be really helpful for people to see that in action in our industry as well.
Yeah, 100%. And another thing that comes to mind for me, Tom, maybe you feel the same, is that people within our sector, you go through a journey of comprehension, don't you? There's those four layers of learning. And I think that to maybe discuss that at some point for those relatively new to the industry who may be hearing things
Mm.
and interpreting them in a certain way, whereas those who've been in the industry a long time interpret them differently because they have a different comprehension. So I think the way we learn is probably a big part of what we might be discussing,
Mhm.
because that's where I think a lot of confusion can come, certainly in the beginning of the learning journey, don't you think?
Yeah. No, definitely. I think I've gone back and forth on this for a lot of years, as obviously I teach with you. And I think I've always thought, can you fast forward those learning curves? And I think to a degree you can. I still think they're really necessary to go through those Kubler-Ross phases. But I know on my end, I've had times where I'm like, I don't know anything, and then my confidence is really low, and I don't know what really to do exercise-wise. And but fortunately, I've just maintained the pathway to go through that journey, and that's again through talking to professionals and getting their opinion and their experience. And then you end up on the other end, still with loads of questions, but you now have more of a approach to how you can handle those questions rather than just feeling like you don't know anything. And I think for a lot of people, they get stuck there if they don't have this sort of open dialogue, if they can't at least hear it and feel like they're part of it.
Yeah, yeah. There's I know Katie Bowman, who's a Canadian biomechanist. She wrote the book "Move Your DNA," and one of her statements I really like that I share with people is, "We may not answer your questions, but we might help you make the question go away," which is a nice way, I think, of the way we learn and how we go through phases. And also Mike Stewart,
Yeah.
who is a clinical educational professional. He's also he's a physio, but he runs No Pain, KNOW, and he talks about the layers of learning, the four layers, and layer three is confusion state.
Mm-hmm.
And I've started to the description you gave is exactly where I used to be. It's like, I don't know anything. That's a problem.
Mm-hmm.
I now embrace confusion. So
Mm-hmm.
I've just gone through my yoga learning journey for the last 3 years, and I definitely hit confusion in the early days. Imposter syndrome. I've been teaching 35 years. Suddenly, yoga just spun all that on its head. And I remembered Mike Stewart's words that that confusion state is where you start to ask a lot of questions. you feel like you don't have the answers to, so you feel like you don't know a lot. But
Mhm.
that's where searching for those questions and what they mean is how you get a deeper understanding. So I now
Mm.
teach embrace the confusion.
Yeah. Well, I think it's also like it's realizing that what we do as either personal trainers or therapeutic practitioners, whatever your area is what we do is an applied science. So we're not strictly practicing science because you'd have to be in a controlled scenario for that. So obviously we refer to evidence to inform us about ideas or approaches or a better way to do something, but it always comes down to your experience, your client's experience, the environment you're in. And I think that being aware of that you don't have to be stringent per se to a strict set of rules. I think that gives a bit less density in how you can approach learning. So you can actually learn with a bit more flexibility and more creativity, which I think for a lot of people can down regulate that anxiety that they can often have when they're in the classroom.
Yeah, it comes back to the government guidelines, doesn't it, on things like low back pain and exercise professionals and the GP referral system. They're just guidelines.
Mm-hmm.
They're not law, but if you follow those guidelines, then you'll be seen favourably should anything, worst case scenario happen. So I think you're right, particularly in our sector, which isn't regulated, the fact it's an applied science, the diversities of bodies, is probably why we get into these deep discussions we're going to over the coming months.
I think that's why what's interesting with what we do specifically with biomechanics education and obviously the workshops, the diplomas is obviously in the name is biomechanics. So that might give the impression that we have a very linear way of working and it's very mechanical and it's X, Y, and Z, where really what we're doing is we use the lens of biomechanics as a science to understand human movement, but then we obviously take it a lot further with regards to the human experience and working, like you just said, with different bodies, with the variability in anatomy, and then also just the different frame of references that our students come from. So whether they're a Pilates teacher or a strength and conditioning coach or a massage therapist, they're all going to use the system that we teach differently. And I think there's it's almost like a microcosm of learning where you learn some rules per se in a system, in a method, but then once you've gone through that initial period of learning something, you can expand it into a much bigger scope with regards to how you're going to implement it into your business or into your movement practice.
Yeah, it's a big part, isn't it, of the facilitated discussions that we have both in the classroom and between us when, what I kind of almost hope to hear is a disagreement. And I encourage the people in the classroom, it's okay to professionally disagree. If you're a sports therapist, you're a personal trainer, you're not going to apply it the same. You can have a different way of applying it. But if we can get to the point, hopefully, through these discussions, we may begin with some disagreements. That would be interesting, wouldn't it, Tom? And then we'll dive into research, dissect the questions, and hopefully have healthy professional discussions that may disagree, which would actually be wonderful for people to follow. And what we'd like you to do is drop any questions into the comments. So if you've got any questions you'd like us to discuss, then let us know. But we're going to see you probably in the next video. Hey, Tom.
Yeah, sounds great. I'm looking forward to it.